Diabetes is out of control, not only in our country, but in really worldwide. And too often patients are put on medication, they're told to decrease the sugar in their diet, and it's not helping. Obesity is still on the rise, diabetes is out of control, even when people are on drugs, lowering their insulin. So a doctor by the name of Dr. Barbara Corkey, and this is a decade ago, about 2011, a little bit more. She got an award from the American Diabetic Association for her work that has really not been embraced. It's been cited by thousands of research studies, so as far as its importance, but it hasn't been embraced in day-to-day medical knowledge as far as working with patients, and so I thought it was something we should review. Typically what we understand is that people with diabetes tend to eat too much refined sugar, refined carbohydrates. That raises their glucose. The body in response raises insulin, and the job of insulin is to open the doors for the cells and bring the glucose into the cells. And then as the glucose rises more and more because of the bad diet the person's eating, the cells, you know, you could look at it this way, or like stuffed, you know, they're so full, they're like, no more. And so the cells become resistant to the message from insulin to, no, open your doors, let more glucose in. And they're like, no, I don't want any more glucose, I'm stuffed. So what happens is the glucose can't get into the cells. This is called insulin resistance. And the glucose is circulating around the bloodstream. And at that point, you're typically diagnosed with diabetes, but also the glucose then tends to turn into fat in different organs, and so you get fatty liver, you can get trouble with blindness, kidneys malfunctioning, and so that's the downstream effect of diabetes. So this Dr. Barbara Corkey said, well, what else is it? If it's simply a matter of changing the diet and you know, trying that way to get insulin